to take one of my small children into the hospital for an emergency, and as you're filling out the application and going through that admitting process, the question is, it's like, oh, you have insurance. Yes, I have insurance. I have car insurance, I have health insurance. Which insurance would you like to see? And it's always, you don't see, other people being asked and being just shocked. Oh, you have insurance? Well, yes, I do, and that's been something that it's always kind of put me off when it's approached like that.
Oregon has become more racially and ethnically diverse. A more diverse population requires an array of strategies to meet the needs of growing racial and ethnic minority communities. The Oregon Health Authority Office of Equity and Inclusion funded community listening sessions to obtain feedback on the impact of culturally competent health services. A total of 24 community organizations participated, and participants in the listening sessions were of mixed gender, diverse ethnicity, and varied ages, representing rural and urban communities across Oregon. The 4 themes that emerged from the listening sessions were language barriers, misdiagnosis or negative outcomes, lack of interpersonal skills by the providers, and lack of cultural sensitivity or understanding of cultural norms.
I've personally had a physician who told me that because he was Mormon that he didn't believe in the gay lifestyle, and so I personally felt that would come across on the way he treats me around healthcare.
Our instructor actually taught us what the norms are for each culture. So she would say, we have 3 feet, we as in our culture prefer 3 feet of our space, our bubble. We as a culture are predominantly Christian oriented. We as a culture, but in her saying it like that, it pulled apart. Instead of her saying Caucasians, she said we, and said all these norms of Caucasians. And then she said Hispanics or Latinos as a culture are loud, assertive. They speak Spanglish. They have a difficult time understanding English. They have different type of families. So all of a sudden she separated Hispanics, and then she did the same thing with African Americans, that they bow their heads a lot, and they are overly excited and can be aggressive.
There's a national survey that's done through each state called the Behavioral Risk Factor Surveillance System. We know that minority women report twice as often having fair or poor health. That's in across the country. You get that kind of perceptual difference. Nobody knows what anybody else says, so there's an objectivity to that, and that's just one example of where the data tells you the big picture, the personal stories that folks say, this is what happened to me as I was trying to be involved in the healthcare system. And so, and I think that's where when you talk about the stories, the listening that occurs, that's really crucial, because that gets down to the local level, to that neighborhood level of folks being able to say, this is my experience.
When we went for emergency at the medical clinic for help, we thought that they were going to be treated the way we thought it's going to be, but they don't treat us very good. When we went there, we asked questions. They told us to sit and wait, and then we wait for a long period of time. My sister-in-law, she was pregnant that time. I went with her. We went to the hospital. We went asked that she's has a pain and she's has to deliver a baby. When we went there, we talked to the receptionist at the front. We tell them that she cannot move, she cannot handle the pain, and she usually come down there for checkup. And all her information they already know about how's the baby's doing. She's not doing very fine. And while we were there for an emergency, we thought that they're gonna be taking her as soon as possible because they already know the baby was not normal. And they take our information and then they ask us to wait in the waiting room. From the beginning, we wait like 30 minutes and then an hour, 2 hours. After that, I went asked the lady how long we have to be waiting. She cannot handle the pain. After 5 hours, the nurse came out and called her name. Then they took her in. 5 minutes, the husband came out and they said they're gonna transfer her to Portland because they cannot do anything. They cannot take out the baby. They have to take to Portland because they don't have the stuff to use to take out the baby that was in that kind of condition. And I was like, why are they letting us wait for a long time? They already know what happened to the baby before. Why do we have to wait? Then they take her to Portland. When she was there, they take out the baby, she's gone.
Part of it is, number one, there's distrust. It's very difficult to talk about situations when you feel that you don't have a voice, which is why we titled our listening sessions The Power of Your Voice, because we want to transmit to people from communities of color that their voice is important. I think the secondary issue is that over time, when you are alone and isolated in a situation and experience where maybe there have been challenges in receiving what you feel is good health care, not knowing what to do, being afraid to do something, again, fear, distrust, and not then taking the next steps to ensure that you're protecting yourself and your family.
La doctora fue en un hospital,
The doctor at the hospital,
me da tristeza.
it makes me really sad.
Porque me sentí muy discriminada esta vez.
I felt very discriminated.
La doctora, estuve 3 horas en trabajo de parto.
I was 3 hours in labor.
La doctora ya estaba lista para que naciera mi bebé.
The doctor was not ready for my baby to be born.
Yo ya no podía con los dolores de parto. Mi bebé también estaba ya, pienso que estaba muy mal.
I couldn't take it anymore with the pain, and I think the baby was really doing bad.
La empezaron a nombrar y aún así tardó casi 1 hora en
They
regresar
started
la
paging
doctora.
her, and she still took an hour to get there.
Cuando llegó la doctora,
When the doctor got there,
ya estaba la niña casi afuera y
the baby was almost out.
estaba muy morada la niña.
She was very
negra,
purple.
no sé. Y ahí me dejó, nada más nació y se fue.
And the baby was born, and then she left.
Después regresó a las casi 3 horas.
And then 3 hours later, she came
Y
back.
llegó con un doctor.
She came back with a doctor.
me rasgué bastante
because I ripped pretty bad.
y más o menos me cosieron como más de una hora.
And they were stitching me for more than an hour.
Y después jamás volví a ver a la doctora, ni
And then I
me fue a
never saw
ver
the
nunca.
doctor. I never saw the doctor.
Y me dieron de alta y la doctora nunca volvió a visitarme. Me sentí muy discriminada con la doctora.
And then she let me go, but she never came back. I felt really discriminated by the doctor.
Y yo quisiera que fuera con las doctoras que fueran más humanos con uno.
And I would like for the doctors to be a little bit more human with us.
The truth is the healthcare professionals are the ones that are in charge. They're in that position of control. And anytime you're in position of control, you have to take more responsibility for the interaction, it seems to me. And so we have to talk about, but one of the ways to do that is to have more folks of diverse backgrounds in those professional positions. But then it's also important to talk about cultural competence training through continuing education, et cetera, for already existing professionals.
If I was an interpreter, I don't know anything about the medical field. So if I show up and I just try to interpret a language for you, that's not going to be, in my opinion, effective enough. I feel as though it should be someone who is educated in the medical field, like a nurse's assistant or a nurse, or maybe even a physician, and who's going through their medical training or something and need extra hours. I don't know. I'm just making suggestions. So I'm simply saying that this individual would honestly be able to have a good conversation enough with you to explain that this is the diagnosis, this is what it means, here's some more resources, here's some more information for you. And then if you still do not understand or do not know, maybe you don't have computer access, you can't look at things on the internet, they'll have a resource center where they can sit down with you, and help you understand medically what the symptoms are, or help you better communicate.
I had asked a physician one time, and throws them off, and it's almost funny to me. And he'll tell me this, I go, how many black people have you operated on? Throws them off. Just throws, and they go, isn't it this, lots. Or it's when they stumble, go get another one. Okay, if they stumble. One told me, well, you're made the same. No, that's not true.
We have keloid skin sometimes.
Yeah, I told him about I said, black skin, keloids. Do you know about that? Never heard of it. And so, do you cut, sew, or do you staple? You staple, you get the keloid. And those are a lot of things that we need to know. So we need to not be afraid. We will spend more time picking out a coach first than we do with the doctor.
I think most folks who are in those positions not in power pick up pretty quickly whether somebody seems to be on their side or not.
We want to acknowledge the limitations of this analysis. First, the numbers of participants in the community listening sessions were small. Secondly, the use of storytelling or personal, oral, and written testimony is subjective. Finally, members of the community who participated may not be representative of the group or community to which they belong. We hope that you will join with the Office of Equity and Inclusion and our partners who contributed to this video to make cultural competence a norm and a standard of high-quality healthcare services in Oregon.
As I have traveled around the world, and I see how fortunate we are here in America. When I've gone to third world countries and went by hospitals, and sometimes we'd be standing outside, broken glass, we're looking inside to the patients. Sometimes we would go and take a look and it'd be a cement floor, and just an old-fashioned refrigerator that's trying to keep medical supplies. And then you take a look at the sanitation, they're just washing with water, not necessarily having soap. We're so fortunate in America to have the health care that we do have available to us. And the beauty of being in America is we have the right and the opportunity to address issues and speak loudly and clearly to compliment the things that we see being done well, but also to speak up when we see the opportunity for improvement.